Good morning and welcome everyone. My name is Belen and I am delighted that you could join us for the first annual National Health IT Collaborative for the Underserved Conference. The National Health IT Collaborative for the Underserved is a multicultural, public-private community partnership focused on health information technology to advance the health of the underserved, with the emphasis on communities of color. Since 2008, we have been committed to engaging providers and consumers from our communities, ensuring they benefit equitably from health information technology advances and resources. We were established to ensure that our nation's underserved populations are not left behind as information technologies are developed and employed. Most specifically, we leverage HIT to eliminate health disparities and achieve health equity in underserved communities and populations. We accomplish this by assisting with adoption and utilization, education and outreach, workforce development and training, as well as policy development and implementation. Our theme this year is Connecting for Health Empowerment, using health information technology to transform care in multicultural communities. This theme describes a vision that NHIT has held since our inception. We believe public-private community stakeholders working together can achieve health equity and produce measurable changes in the health and well-being of our communities. Your presence today reinforces our vision, and we thank you for joining us. Now, I want to acknowledge and express special thanks to our sponsors, the Aetna Foundation, for their generosity which enable us to provide you with today's program as well as today's live webcast. The U.S. Department of Health and Human Services, Office of Minority Health, whose partnership continues to be invaluable. The Kaiser Permanente, TRACFON, the Morehouse School of Medicine, the Ponce School of Medicine, Acacia Network, AmeriHealth, and Visionary Consultants for their support. I also want to thank HIMSS, a co-founder of the Collaborative, for their continued support, including extending a partnership opportunity to NHIT for this week's National Health IT Week. I want to extend a special welcome and thanks to our National Leaders Forum, speakers who are giants in their respective fields. Dr. Karen DeSalvo, Dr. Nadine Gracia, Dr. Graf Graham, and FCC Commissioner Clyburn, who will be joining us later this morning, and we are honored that they are with us today. Unfortunately, Senator Tom Daschle is not able to be with us this morning, but his office has confirmed that he will be with us for breakfast tomorrow morning, and we also thank the Senator for his support of this organization. Today, we start an exciting and critical initiative for our community. We all have the opportunity to contribute to shape the next chapter of the National Health IT Collaborative for the Underserved. Beginning next week, we will be starting our capital campaign to strengthen the commitment of this organization. Following this conference, we will review carefully the recommendations of our national leaders in the 4 panels that will follow. Your contributions will guide our 5-year plan, which will be shared as a blueprint for collective action. And we pledge to stay connected in the months and years ahead. I now want to introduce our first speaker. And we've changed the order around a little, but we're going to go ahead and we're going to start with Dr. Karen DeSalvo. The breadth and experiences and contributions of our next keynote speaker have been integral in setting the stage for the future of health information technology for vulnerable populations. Dr. Karen DeSalvo serves as the National Coordinator for Health Information Technology at HHS. In this role, she leads the nation's charge to adopt and meaningfully use of health information technology and collectively achieve health IT interoperability as a core fundamental element of better care at a lower cost for better health for everyone in the United States. She brings to this position a unique combination of experiences, including providing leadership for the rebuilding of the healthcare systems after the devastation of Hurricane Katrina in New Orleans. She is intimately familiar with the challenges facing underserved communities of color, and we welcome her insights about how HIT might transform those communities. Dr. Karen DeSalvo, we appreciate your presence and we welcome you. Thank you for being here.